why is it so difficult for them to come up with a cure? Is it because no two people affected the same way, or?
It's because MS is a really wrong disease to get. It would have been better if nobody had gotten it. It's just too darn complicated.
Yeah.
We may look smart, but we're really kind of pushing the envelope here, step by step, day by day, in understanding this very complex disease and the ways that we can intervene on the mechanism that the body responds to the disease. Mm-hmm. And that latter issue is actually some of the most important problems that are presented to the doctor and the patient in, of course, treating multiple sclerosis. Mm-hmm. And that, again, is there's an inciting factor that starts the disease on its way, but a lot of what we see that causes pain and suffering is actually the immune system in the body's reaction and response to it. Not only to it, but also to the interventions that we do too, right. Which is another thing that doctors and patients really need to work together with a disease like MS, talking about what is reasonable in terms of diagnosis, when you can make the diagnosis in the life cycle of the disease, when are you sure that it's MS and not something else, and when it's worth talking about MS, when is it worth treating it, and then if you want to treat it, what are you going to use to treat it, and how are you going to person who's got it. The medicine is not going to work if the person is not feeling they're living a fulfilled life. If they're miserable, it doesn't matter what you're doing to the MS. Right. The person's miserable. You are not giving them what I'll call eudaimonia, which is the fulfilled life. And as such, I think doctors have to be cognizant of that extended person beyond the immune system and nervous system. And some of the decisions about therapies have to be derived from a sense of what that person wishes to do in their life and what kind of risks are they willing to take with their body, with their lives, with the social network that they are embedded in. What kind of risks does that entail? Taking a step back on how much can they do in certain ways to ameliorate the disease, how much can they do to improve their life along the way. And doctors and patients have to check in on a regular basis in order to make sure that the adjustments necessary as time goes by and the complexity of life presents new challenges, gives us new variables or values for the variables.
Did you, when you were practicing, did you notice a difference in patients that had an optimistic attitude and the patients that had kind of a glass half empty attitude in their processing of the disability?